Okay, now let's talk about the power of plants. So did you know that even as much as 90% of all chronic diseases are preventable? Diseases like Alzheimer's, heart disease, type 2 diabetes, obesity, cancer, and more are preventable and many times reversible through lifestyle-related factors. And it's the basics. A healthy diet centered around whole plants, movement, getting enough sleep, stress management, and not smoking. We've all been told these things, but most of us blow it off and don't really understand quite how powerful they really are. But there's a fascinating new area of scientific research called epigenetics, and it's how our lifestyle and our environment can turn on and off our genes. So we may have the genes for heart disease, cancer, Alzheimer's, diabetes, autoimmune disorders, but it doesn't mean they will be turned on. We can turn off the disease-causing genes and turn on the health-promoting genes through our lifestyle, with our diet being one of the biggest factors. And I love this quote: genes load the gun, but diet and lifestyle pull the trigger. This means that 90% of the power is in your hands. And even if you do have some gene that predisposes you to a certain chronic disease, that does not mean that you will get it and that your diet and lifestyle has a lot to do with it. So ask yourself, which genes do I want to turn on today? And when we're talking about brain health, a study using a plant-based diet called the MIND diet, which is a diet rich in fruit, grains, beans, vegetables, nuts, and seeds, and that limits the intake of meat, dairy, and processed foods, showed a 53% reduction in the risk for Alzheimer's disease. And they showed that they had the cognitive function similar to someone that was 7.5 years younger. There was also a study out of Rush University showing that people who ate at least one serving of dark leafy greens a day appeared to be 11 years younger cognitively. And then heart disease is well documented that it can be reversed, halted and reversed on a plant-based diet. Dr. Caldwell Esselstyn wrote his book, How to Prevent and Reverse Heart Disease, and has done multiple studies showing actual reversal of the heart disease, arteries opening back up, improved endothelial function, lowered cholesterol, lowered blood pressure, and angina symptoms disappearing. He basically took patients with major heart disease who medical science had said they could no longer help them. They were basically told to go home and wait to die. And he reversed their heart disease with a whole food plant-based diet. Now, there's also Dr. Dean Ornish's program for reversing heart disease. And his program also includes a low-fat, whole food plant-based diet, stress reduction, exercise, and actively engaging in supportive relationships. Now, the cost of the Ornish program is currently around $9,500 and helps to reverse the actual disease. Compare that to a quadruple bypass that costs around $50,000 to $70,000, but does nothing to address the underlying cause. After bypass surgery, many still have angina or have to go through more procedures like stents and repeat bypass surgeries, not to mention the pills they have to take the rest of their lives. And all this adds up to more money out of pocket, more money the insurance companies pays, co-pays, deductibles, lost wages, not to mention the continued pain, worry, and stress from the progressively worsening heart disease. Now, Dr. Dean Ornish's program is actually currently covered by many insurance companies, including Medicare, Aetna, and Blue Shield of California. Now, how about our immune system? In a recent study published by the British Medical Journal involving 6 different countries of healthcare workers who were on the front lines of COVID-19, they found that those who were on a vegan or plant-based diet had a 73% lower chance of moderate to severe illness. Yet when they looked at those who reported eating a low-carb, high-protein diet like keto, those people actually had a 48% more likely chance to having moderate or severe illness. So that's a huge difference between eating a plant-based diet and a high meat-based diet and COVID outcomes. But what is the right plant-based diet? Because there's 3 main plant-based diets you've probably heard about: vegetarian, vegan, and maybe whole food plant-based. So while vegetarians are doing it a step up from eating beef, chicken, or pork, many do still consume dairy, especially cheese. And this is where many can struggle with health because all of the calorie-dense cheese and health effects from the saturated fat, hormones, and cholesterol. Some vegetarians even eat eggs or fish. Eggs are little cholesterol bombs at around 200 milligrams for just one egg, and fish, we've learned, is highly polluted. Many vegetarians also consume processed foods, white flour, sugar, white bread, white rice, and oil. Vegans take it one step further and don't eat any meat, dairy, eggs, or fish, but many still consume lots of processed foods like vegan fake meats, vegan cheese, white flour, sugar, white bread, white rice, and oil. And many vegans got started for ethical reasons and don't use any products made from or tested on animals like leather, and that's awesome. But depending on the balance of foods in a vegan diet, they may be more of a junk food vegan if they don't consume very many whole plant foods. So that may not be much different from the standard American diet as well. Lastly, there's whole food plant-based, also known as WFPB, which really focuses on eating the majority of calories from the most nutrient-dense foods. A whole food plant-based diet includes whole plants, minimally processed, like vegetables, legumes, which are beans, lentils, peas, and soy, fruit, whole grains, and even nuts and seeds. And they avoid or limit meat, dairy, fish, eggs, or animal products, as well as avoiding and limiting processed foods that include oil, sugar, and sodium. And I really like the quote by Dr. Michael Greger. He says, "Nothing bad added and nothing good taken away," because this really speaks to the minimally processed aspect of whole food plant-based eating. So WFP, or whole food plant-based, is like the gold standard for health and longevity. Why? Well, for starters, whole plants contain so many vitamins, minerals, phytonutrients, and antioxidants, there's no way they could ever be put into a pill. In fact, there's tens of thousands of phytonutrients, nutrients that only come from plants, that haven't even been fully studied yet, but scientists know they're there and they're probably important for health and bodily function. Whole plants contains lots of fiber, which most Americans don't get near enough of. Whole plants are anti-inflammatory. Well, animal and processed foods are pro-inflammatory. These foods will fill you up and keep you full all day long so you don't have crazy cravings. And the blue zones are areas in the world with the highest concentration of centenarians per capita, and Dan Buettner from the National Geographic went out and studied them. Places like Okinawa, Sardinia, Italy, Ikara, Greece, Nicoya Peninsula, and Costa Rica. And we even have one here in the US in Loma Linda, California, where a large population of Seventh-day Adventists live. Now, what did these blue zones have in common? Well, they were all 90 to 95% whole food plant-based. These people were living into their 90s and hundreds and had such vitality and clear-mindedness, no chronic diseases, no dementia, still independent and mobile and loving life. So if you're worried about having to go 100% right away, don't worry about perfection. Could you do 90% like whole food plant-based like the blue zones? You know, it's basically flipping the script from the standard American diet from 90% calories from animal products and processed foods to instead 90% whole plants.